Good afternoon and welcome everyone to the COVID-19 Employer Information Town Hall. My name is Andy Constable. I'm the Economic Development Manager for the County of Santa Cruz, and I will be acting as your host today. Next slide, please. Today's presentation is being provided to you by the Health Services Agency for the County of Santa Cruz, and our speakers today will be Jennifer Herrera, the Chief of Public Health for the County of Santa Cruz, and Emily Chung, Public Health Manager also for the County of Santa Cruz. But before we get started, we'd like to take a moment to acknowledge that the pandemic has created significant challenges for individual health and the economic health of our community and local businesses. So with that in mind, the purpose of today's presentation is to provide employers with the information and resources that are available to help reduce the spread of COVID-19, and in the process, help us all to return to some level of normal. So a couple of housekeeping items before we get started. First, to let you know that your time is valuable and that we appreciate you participating today. We will attempt to do our best to finish the presentation in about an hour. Next, because this is in part a visual presentation, we encourage you to access this town hall through Microsoft Teams for the best experience. Questions during the presentation today can only be asked through Microsoft Teams chat, which you'll see on the side of the presentation. For those who cannot use this function, questions can be emailed and will be addressed after the call. Answers will be posted on the county's health services website. And for purposes of this meeting, the email address for those questions is as follows: hsapphadmin@santacruzhealth.us. Again, it is hsaph, in all caps, admin@santacruzhealth.us. Lastly, as you might notice at the top of your screen, if you're using Teams, this presentation is being recorded, and we will try to use it in the future for any type of public resource necessity. Next slide, please. So kind of a quick agenda overview. The first half of the presentation is going to be the actual PowerPoint, followed by the second half, which will be about 30 minutes of a Q&A period. It's important to note that this presentation will not cover industry-specific guidance. That guidance can be found on the state's COVID-19 website, which is covid19.ca.gov/industry-guidance. Again, covid19.ca.gov/industry-guidance. And lastly, the topics that we're intending to discuss today include the following: existing resources for employers and employees, current law and upcoming changes, and employer responsibilities. So the topics will be covered in that order in about 30 minutes, followed by about a 30-minute question and answer period. And with that, I'd like to turn it over to Jennifer Herrera, Chief of Public Health.
Thanks so much, Andy, and thank you all for joining us today in our first town hall that's specific for employers. So first, I'm just going to do a brief overview of who we are in public health. We are one of the divisions under the Health Services Agency here at the County of Santa Cruz, and our vision is to see better health every day for everyone. And we do that through our mission of collaborating with the community to protect, promote, and improve the health and well-being for all. Case in point, us wanting to have this town hall in collaboration with all of you as employers. And specifically, as a public health department or a county public health department, we're legally responsible for the control of communicable disease in the county. And so we do this not just through COVID-19, but we also follow things like STDs, HIV, E. coli, and all of that. So as a tactic that we typically utilize to control the spread of disease in a community is through this idea of test, trace, isolate. So ensuring that there's testing so we can identify people in the community with a certain disease, do contact tracing and investigation, and then isolate those folks so that we can control the spread. And as a local health department at the county level, we are directly connected with the California Department of Public Health. And that is where we receive a lot of our guidance as a local agency. And specific for the COVID response, our overall goal is to save as many lives as possible in Santa Cruz County. And we do that through the acronym of SAVE, slowing the spread of COVID-19 and supporting our community with adaptations to this new normal that we are living in, ensuring that vaccines and therapeutics or medications are made available to our local community, and elevating public health readiness. So now in the next few slides, I'll just do a quick situational status of what COVID-19 looks like in our community. Many of you are likely aware of our data dashboards on our website, santacruzcounty.org/coronavirus. We have a lot of data, and I'm only going to scratch the surface of what we have available in order to ensure we have time for question and answers. So as of this morning, we have 3,819 total known cases of COVID-19 in Santa Cruz County. 783 of those are active, 3,009 are recovered, and we have had 27 deaths due to COVID-19. On the bottom left, you'll see our epidemic curve, along with an orange line that shows the total number of known cases. And you'll see that we had a spike in the summer. We had a peak, and then we were kind of declining, and now we are at a significant rise in cases, something that we had not seen previously in this pandemic. On the right side, you'll see the most likely source of exposure to COVID-19 for our cases. This is identified through our, when our investigators contact people who are positive for COVID-19, we go through a questionnaire to identify where the most likely source of exposure happened. And typically it's person to person within a household. And this is in line with not just regionally, but internationally, studies show that household spread is a major contributor for COVID-19. However, workplace is still affected by this. Many household members or many people go to work while they are symptomatic, or even though there are precautions in the workplace, sometimes employees are more relaxed around COVID-19 precautions in break room settings. Many staff members live together, and so even though you may not have spread in the workplace, and it's household associated, it does affect our workforce. And then this graph compare to other counties. Santa Cruz County is the green dotted line here, and you can see that our number of cases have been a lot less than many other counties. However, most recently, you can see the trajectory of our cases have started to increase, but we do have less cases generally in our community than other counties. This is not a surprise to you. This is likely not a surprise to you all. This is the California Blueprint for a Safer Economy and the tiered system in order to reopen industries as safely as possible in our community. And as you are probably all aware, we are in the purple tier, and I'm sharing this, the metrics here, but also just the visual of California and all the other counties, and you can see it's a sea of purple. Most counties are in the purple in order to, so many counties are scaling back on industries in order to slow the spread of COVID. And in Santa Cruz County, our metrics are here. Our case rate is 11 and our positivity rate is 3.9%. And I'll just move through this slide and go straight into COVID-19, a quick overview of what it is. How does it spread, and when can employees return to work? So what is COVID-19? There are many types of coronavirus, including a strain that causes the common cold. And the new strain of coronavirus is called SARS-CoV-2. And COVID-19 is actually the disease that is caused by the novel coronavirus, SARS-CoV-2. How does it spread? It's spread through respiratory droplets and particles, and it's very easy to spread person to person. Most spread is during prolonged close contact. So when people are close together within 6 feet or 2 arms lengths away for about 15 minutes in a 24-hour period. There are 3 ways that COVID-19 could spread, and it's most commonly spread through droplets. So coughing, sneezing, singing, talking, breathing within that close proximity. There is a potential for spread through airborne transmission, and that's when droplets linger in the air. And thus, this is more risky in areas in indoor spaces with inadequate ventilation. And then a less common method, but possible method of transmission is getting it through contaminated surfaces. And I just want to touch on, because it's droplet, it's spread through droplets, I wanted to touch on the importance and impact that proper face coverings have. So here on the bottom graphic of the correct mask use versus incorrect mask use, it's when people are wearing masks, face coverings correctly, it really does decrease the amount of contact spread of droplets of COVID for the virus that causes COVID-19. The top graphic you can see is just a face shield without a face covering that covers the mouth and the nose. And you can see that it's a good visual to just think through why a face shield in and of itself, even though it goes down to the chin, is not as effective. And then, of course, we have N95 respirators and surgical masks. We have N95 respirators available for healthcare personnel who come in contact with people who are who have COVID-19. And I just want to remind all employers that if you are offering N95 respirators to your staff, that you should be offering fit testing as well, so that it's that your staff have a proper seal and know how to ensure that they're wearing it correctly and utilizing it correctly. And this is a really good graphic just to show how quickly COVID through respiratory droplets can spread in about a month. So knowing how COVID-19 is spread, these simple actions help us stay safe. Wearing a mask, staying 6 feet apart, minimize mixing, and washing hands. And with COVID-19 so widespread in our community, it's inevitable that people do become exposed to the virus that causes COVID-19. And so when that happens, we try to stop that spread through isolation and quarantine. Quarantine is used to keep someone who might have been exposed to COVID-19 away from others. And it could take as little as 2 days to as many as 14 days after exposure to COVID-19 to develop. Isolation is used to separate people who have COVID-19 from people who are not infected. Those who have COVID-19 should stay in a separate room away from other people in their household to keep them safe and prevent them from getting ill. If your employees have COVID-19 and are having difficulty with isolation or quarantine, the county does have resources to refer them to for some alternative shelters. And a reminder that there are many self-quarantine isolation guides available in different languages. This is a resource that I hope that you don't have to reproduce, and we will have that. We have that posted on our website. And this slide, I just want to go over the return to work criteria using a symptom-based strategy. So for those who have COVID-19, individuals who've tested positive and have symptoms, or they test negative but they have symptoms, or they have not been tested but have symptoms, the return to work criteria is the same. Basically, 10 days have to pass since their symptoms appear. At least 24 hours have passed without fever and use of fever-reducing medication, and symptoms have to have improved. Those who test positive and never develop symptoms, they can return to work 10 days after their first positive test for COVID-19. For those who've been exposed, so these are people who are quarantining to COVID because of an exposure to COVID-19 because they were a close contact. If they test negative and do not have symptoms, or they have not been tested and do not have symptoms, they can return to work 14 days after last exposure, assuming that they are asymptomatic or they don't have symptoms. And a big takeaway I have here on the slide is test-based strategy, which is using a test to clear someone to come back to work, is not recommended. People who were exposed, and the reason for that is that people may test positive even though they are no longer infectious. Because what the infectious period is really that 10-day window, which is why we use that symptom-based strategy. And what will happen is that the people will still show up as positive on a test, even though they're no longer infectious. Also, people who were previously positive are not recommended to be retested 90 days after the onset of infection because they are unlikely to be reinfected with COVID-19 during this time frame. And then in regards to quarantine, people who were exposed should quarantine for 14 days even if they tested negative. And a big reason for that is because they could potentially show up as positive again anytime between 2 to 14 days after their exposure. And I do want to point out that there is a rare exception for exposed workers who have no symptoms and have a negative or unknown test result. And this is an exception for the quarantine, where the 14-day quarantine would compromise essential operations. Workers may return earlier if the employee and employer are able to maintain strict safety requirements that are noted in the California's Employer Playbook. And I will turn it over to Emily Chung to talk about AB 685.
Good afternoon. My name is Emily Chung. I'm the Public Health Manager, and I am going to share some information first about the new law that was signed by Governor Newsom on September 17th of this year, which impacts all employers except for those who are doing direct care services for healthcare. So this is for all private and public employers in the state of California. This new law builds on existing CDPH requirements around notifications of COVID exposures. So currently, CDPH requires all workplaces to notify the local health department when there are 3 or more COVID-19 cases among workers at the same work site within a 14-day period. So this is already in effect, and we are receiving reports such as those from employers as required. That continues with this new law, and we want to encourage employers to work closely with the health department, with our agency, when there are these 3 or more employees, which is considered an outbreak. In addition to sharing information about the exposure, the requirement includes that you have 48 hours to notify our local health department of this exposure of an outbreak, and to provide detailed information about the work site, the names and occupations of the workers who have COVID, and a list of those who might have been exposed to those positives during the period when they were at work and infectious. So this is a collaborative process that we encourage the employers to work well with our staff and our case investigators. And we're here to partner with you on what we call line lists to determine who are close contacts. What's new in AB 685, it strengthens the Cal OSHA and other requirements for employers related to improving the health and safety conditions for employees related to COVID-19. So for employers, what changes is that as of January 1st in 2021, employers must notify employees when they may have been exposed to COVID-19 in their work setting. So a written notification must be provided to all employees and subcontracted workers within 1 business day of being notified that there was potential exposure. So when your company finds out there was a potential exposure, then you have 1 day to provide something in writing to your employees and subcontractors. That notification also is requires employers to now share information about benefits, the local, federal, and state benefits around paid leave, workers' comp, and any other anti-discrimination protections. And this is something that is new, and we wanted to make sure this is on everyone's radar as this is in effect on January 1st. The last part of the bill of 685 does include some additional authorization for Cal OSHA to protect the workers in work sites where there are violations. And I encourage you to review the language on the link listed here from CDPH, and there are some great resources on the website. Again, we'll be sharing these slide sets out, and so hopefully you can click onto those slides and find the links to this information. Next slide. Okay, so I also want to share about other resources for employers. I'm going to cover 3 main areas of resources and talk a little bit about income replacement and paid leave and share some resources that you can review for more information. We'll talk a little bit about what social services resources we provide as a community for those who have been impacted by coronavirus. And just we'll remind you about reviewing the industry guidance. Next slide. All the language around income replacement and paid leave is very complicated and confusing. And I want to be really mindful and acknowledge that and know that as employers, I'm sure it is also challenging for you to navigate all the changes and all the information that's out there. We found this fantastic guide written by CRLA, which is the California Rural Legal Assistance. And they provide support to workers in Santa Cruz and Monterey and other communities. And while there are probably other guides out there, I found this one really easy to review and understand. And there's some great workflows that help walk through the process of different types of income replacement, depending on everybody's unique situations. So I encourage you to look at this guide and walk through it and look at your own example and situation as an employer. So it starts off by asking, why does someone need time off? How big is the organization or company that you are employed in? And then it points to which types of leave someone may or may not be eligible for. So it's a great way to walk through that for yourself as an employer and also for you to use when talking to your employees about what benefits they might be entitled to. So to help you meet the requirement of AB 685, resources like these could be very helpful for you. I'd like to highlight one resource, I'd like to highlight one resource that is new into our from our federal government this year related specifically to coronavirus, and that's the Family First Coronavirus Response Act. And that is a program that has been required by federal law even for small businesses. And employers get reimbursed the cost of employee leaves for coronavirus reasons through refundable tax credits. So while we recognize that paid leave is not tenable necessarily for everybody, but there are resources out there, and I would encourage you to work with your human resources personnel, your lawyers on how to ensure that benefits are made available as required by AB 685. Okay, next slide. In terms of social services that are provided in our community, We have done a wonderful job in the community, but there's a lot more we can be doing to ensure that those who are impacted by COVID have resources available to them. In our public health organization, we have social workers who are working with our cases and contacts of COVID-19 and providing them resources where needed, such as food and wage replacement, where they are not able to get other types of paid leave. We also have isolation and quarantine resources in limited capacity for those who are densely or marginally housed or homeless. We have an alternate housing program where people can get referred into a hotel that is operated by the county. And for those who are in the healthcare professions, your employees can qualify for the California Hotel for Healthcare Workers program. And that's another link that we'll make sure is on this slide so that you can find that easily. But there are various resources for isolation and quarantine available. And our case investigators and contact tracers work really closely with cases and contacts to just help determine what are safe isolation and quarantine opportunities for them. Finally, just to note again, just to know what resources we make available is that we have direct cash aid for low-income families who have been impacted by COVID-19. So these are Medi-Cal eligible families, and they're referred through our federally qualified health centers in our county. So we have 3 federally qualified health centers in our county: Salud para la Gente, Santa Cruz Community Health Center, and our County Health Services Agency clinics. So any of them could refer individuals to that. And the point of sharing this information around our resources is so that you know that our county, our community is trying to protect all of our COVID-19 impacted individuals in various ways, and that it's not all on employers, it's not all on the county. It's a really community effort to ensure that resources are there so we can protect the community with isolation and quarantine. And finally, just a reminder is that this website that Andy mentioned earlier, the COVID-19 webpage for the state includes really great industry guidance specific to each of your industries as employers. So that is at covid19.ca.gov/industry-guidance. And that's a really useful resource. You just type in a search and you can find your own guidance for your business. And I think this is back to Jen.
Thanks, Emily. So I just wanted to take a moment to show you all the employer toolkit and website. So I'm going to drag my browser and hopefully you can all see that. It looks like you can. So this is our COVID-19 website. As I mentioned earlier, we do have a lot of data that's updated on a regular basis, and so that's here. I also want to point out that we do have this crosswalk between occupation and identified likely source of exposure. You can click here and kind of see, for instance, service occupations and community acquired transmission and the percentage of known cases. If you right click it, you could show this information as a table as well. So we have a variety of ways to show the data. And also this little icon here provides definition on what these, how we've split up these service industries. So we do have a short URL, santacruzhealth.org/employers, to get to our employer toolkit, but we also have a big blue button here to get to it from our main webpage. So when you click into here, we have these boxes here around. The first one is instituting prevention practices to prevent COVID-19 spread in your workplace, how to prepare for an exposure and outbreak, and how to manage or respond to a potential exposure and outbreak in your work setting. The toolkit, it's all online. We have some links to more detailed guidance. All of our guidance aligns with the California Department of Public Health and CDC. So this link takes you to, the detailed guidance link takes you to the employer playbook that was referenced earlier. We do have a sample employee notification letter that you can use and adapt for your agency. We have our contact tracing form, or line list. We also call it a line list. It's an Excel spreadsheet, and we do have it in English and in Spanish. A link to additional CDC guidance, as well as this California Department of Public Health page for employer questions around AB 685. And when you do have an exposure, this is a stepwise process of how to address it in your workplace. Each of these, I won't go to it, I won't read through each section just in the interest of time, but I'll click here and you can see it is an accordion menu to just kind of go through how to respond to an exposure. And basically you would activate your COVID-19 preparedness plan, identify close contacts to the COVID-19 positive worker. And when you're identifying close contacts, what you're doing is actually supporting us with ensuring people who were close contact are aware and are able to quarantine and maybe get tested appropriately. And the definition of close contact is listed in the contact tracing form as well as this website. Communication with all employees, reporting additional cases as they arise through to us in public health. Per Cal OSHA, reporting any hospitalizations and deaths. And we do have this return to work guidance infographic sheet, which I'll show here. This is what was on our previous slides, and then it has a little bit more information on return to work criteria. That's in English and Spanish. And then you'll see copies of the employee clearance forms that we actually provide when people who are COVID positive ask for some sort of documentation to show that they were positive. And then lastly is just to prevent further workplace transmission within the workplace.
Okay, thanks, Jennifer. So, and Emily also, we'll go into a question and answer period here. Looks like we have several questions that are in the chat. There's a list of the panelists that will be responding to the questions, and let me start with first question. What constitutes a potential exposure?
Do we have Amy Meza on the line?
Hi, yes, this is Amy. So a potential exposure would be an exposure to a known case. So for example, an employee or a customer, patron, client who has been in the workplace and had close contact with people in that setting, and who maybe later finds out that they have a positive COVID test result. One area that seems to be a gray area for employers is often when someone comes to work and says, my cousin just found out she has COVID and I was with her yesterday. That person coming into the workplace after just having contact with somebody else with COVID is not an exposure in and of itself, because that person is a contact to the case. But of course, in that setting, the employer would want to talk about that person possibly quarantining because of the exposure that they had outside the workplace. I hope that helps.
Great, and there are some more questions around exposures, and there's a question here of what if there's no confirmed case of exposure to COVID-19? An employee has a sore throat for a day, goes away, they feel totally fine. How long does someone have to be out of work if no exposure or COVID specific symptoms are showing.
Well, we recommend that people not go to work with symptoms like a sore throat, because that is one of the possible symptoms of COVID. So we would recommend that the employer ask employees with symptoms that could be associated with COVID to stay home and contact their medical provider if the medical provider agrees that it's appropriate to get tested, and then wait to come back to the workplace until that test result is known.
And Amy, could you just reiterate what is an exposure or close contact?
Close contact would be considered being within 6 feet of someone, either somebody who's known to have COVID or to have to somebody with those symptoms and who is a close contact to someone, say at home, who's a known COVID case, to be within 6 feet of that person for 15 minutes or longer in a 24-hour period. And that could be cumulative time, it doesn't have to be 15 minutes in a row. And even the use of cloth face mask or a simple face mask at that proximity would be still considered an exposure.
Thanks, Amy. And there's a question of, do we notify every employee even if there is no way that they were exposed? So I will, Emily, is there any language from the state on that new assembly bill on this piece?
Yeah, so the AB 685 language does make clear that which workers must be notified are those employers and subcontract employees who are at the same work site as the worker who was diagnosed with COVID-19 during their infectious period. Those are the ones that must be notified. So if your worker was not on site when that positive case was on site and infectious, then those workers do not need to be notified as well.
Thanks. So there's another question of, there are actually a couple of questions of what specifically do businesses need to do at offices, especially as they prepare to open up when they're able to. And I guess my guidance is to just refer back to the industry guidance on the California, the governor's Blueprint for a Safer Economy website. And there is another question, should travel be discouraged or work at home implemented after travel? And Amy, would you like to take this, or I can take this?
Go ahead, Jen.
So there is a travel advisory through California Department of Public Health of that people should quarantine for 14 days if they have non-essential travel. That guidance is on the California Department of Public Health's website. In general, we encourage teleworking or being able to maintain those core measures of physical distancing, the ability for people to be able to wash their hands frequently and wear a face covering to really minimize the chance that someone would be defined as a close contact. We do, if possible, we encourage people to follow the CDPH guidance, but that would be based on your business operations. And then I want to note, acknowledge that someone mentioned that tests took 3 weeks to get back, and that is something that we are working with the state on, is trying to improve the turnaround time for testing. we're increasing the amount of testing availability in our community, and we're hoping that the state's new lab capacity will allow for a 48-hour turnaround time for tests. And also just another comment in the chat that says CDC says masks with valves aren't acceptable, and that is correct. And we have had some actually published, we've had some social media around this topic, especially when the face covering guidance was first released.
I can answer a question around the conditions for Cal OSHA to shut down a workplace or worker safety, or maybe not answer it, but I can point. I recommend that any really specific questions on the application of AB 685 that individuals review the bill language, which I'll put in the chat box here. The language is about an imminent threat, that Cal OSHA has the authority to shut down workplaces for imminent threat, and I'm sure they will apply similar guidance as they would in other workplace safety issues. It does not specifically outline, how many violations or anything like that, though, in the language that I could see, but I encourage you to review the bill text yourself. I did also want to mention one more thing around notification to the local public health department, is that if you are a restaurant or food service organization, we also are working closely with environmental health, since environmental health does provide the permits and other regulatory oversight to restaurants and food service industries. So we encourage you to be notifying environmental health as well as the local health department when there are exposures and outbreaks.
Regarding the question about industry guidance for food banks, Denise, we can get back to you on that. We'll have to see what's available in terms of guidance.
Jennifer, there was a question about masks that have valves in them. Is that something somebody could respond to?
Jen did mention that a couple minutes ago, but this is Amy, I can address it a little bit further. The CDC several months ago posted information about masks with valves, and said that so those valves are designed to, they're protective for the wearer. They're designed to, they're one-way valves, so they're designed to prevent pathogens from passing from the outside to the person who's wearing the mask. But they allow for pretty normal exhalation through the valve. So the CDC has said that actually those masks have the potential to concentrate virus if the person wearing the mask were to be infected with COVID. So those are not considered safe for people around the wearer of the mask. Thanks, that's a good question.
And we can review maybe ensuring that our community is aware of that. I think that was the other part of the question. We're always looking for advice from our community members on ways to improve our messaging, and we can check in with our communication staff on that.
And there's a question about people without symptoms not being able to get tested, even if they think that they've been exposed to someone with COVID. So I think on our website, santacruzhealth.org/testing, we do have information about some sites that have testing for people without symptoms, including the OptumServe test site in Watsonville. And I don't know if Emily wants to speak further to that.
Sure. A quick testing update is that while we understand the difficulties of getting testing, and that has definitely been ongoing throughout this pandemic across the country, we continue to keep expanding here as much as we can. And starting November 30th, our state-sponsored OptumServe site at Ramsey Park in Watsonville will be doubling its capacity and open 7 days a week. So that will hopefully increase some of the testing support that we have here. And on our testing page, we try to update it as regularly as possible with any new sites, and a new site that for testing in the community that came online recently is through Seneca Diagnostic Labs, and their information is also on our testing site. And they test those who are insured or uninsured. And if they're considered close contacts, if someone's considered a close contact or has any even mild symptoms or potential exposures, they could get tested through that organization too. There's another testing question around rapid testing with same-day results. So rapid testing, there's a bit of a confusion about the terminology of rapid testing. There are different types of rapid testing. The most common rapid testing is called a point-of-care antigen test, which are different than the gold standard of a PCR test, and Amy might be able to fill in more about the details of the difference. But we do not, there are not very many sites in our county that do any rapid testing unless you're symptomatic, and to provide those same-day results. So I believe I think doctors on duty might do same-day testing, and but it is difficult to find, and also the antigen point-of-care rapid testing has a very specific use for symptomatic and close contacts. Amy, would you add anything to that?
I would echo what you said, Emily, that a lot of the rapid tests are available for people with symptoms, and that's actually related to the licensing that's been done by the FDA, where the test results are not considered valid without the person being in the symptomatic phase of their illness. I know that's kind of confusing, but I think that's all the detail we need right now.
Emily and Amy, I think there's another question on testing of if the accuracy of rapid testing.
Well, I'm not a lab person per se, but I believe that most of the rapid tests that have been approved by the FDA have pretty good reliability. Interestingly, there's a little higher rate of potential false positives with some of them, but yeah, I can't speak anymore to that. Sorry.
Yeah, with most of the point of care testing that's provided in our community, most do have high reliability in terms of if it's a positive, that person is treated as a positive. And where people can get symptomatic testing for with the rapid testing, those would be at some of our healthcare centers. So our hospitals provide that. We do not encourage people necessarily to go to the hospital just to get testing though. Our hospitals are very busy right now, but that is one place that uses rapid testing, and so do some of our primary care settings. So it's best to call and ask if that is something that someone seeks, but that resource is not necessarily as widespread as some people have hoped.
And then I'd like to add to that the OptumServe testing site over in South County in Watsonville, Ramsey Park. When people sign up for an appointment to get tested, they have to complete a questionnaire, and the lab prioritizes those who are who were potentially a close contact or exposed to COVID-19 over. So those lab results are processed or prioritized over someone who says that they haven't had an exposure and they're just, for lack of a better term, they're just kind of curious about their COVID-19 status at that time.
Someone asked.
Oh, go ahead, Amy.
Someone asked about submitting a line list and stating we've been completing a line list for every COVID positive case in our workplace and have not waited until there's three cases at a particular site. Should the person stop this practice? We really are not requesting a line list usually until there's been 3 cases, but that does vary depending on the setting. So what we're encouraging workplaces to do is to, as soon as you have a case, to begin that line list. And an illustration that I like is that it's a living document. To think of it as a living document so that it's kind of an ongoing thing. You're not just completing it once and then it's done. You're starting it when you have an exposure, and you're gonna put names of people in your workplace who have been exposed, and then you're going to use that as a tracking tool. And we'd like to see employers getting used to using that line list and having it be something that's helpful to them. And that way, if you do get more cases and we ask for a copy of your line list, you'll already have it going, and it won't be any extra work for you to send it on to us. We often ask for line lists daily when if you have an outbreak going on, because we want to see if there's any changes on a day-to-day basis, and it's helpful if you've already got it going.
There's a question around face coverings. I'm just gonna hop over my browser again just to show you all the updated face covering guidance through the California Department of Public Health. And in here, it hasn't really changed much from when the state initially put out this guidance, but they did add some more clarification of when individuals are exempt from wearing a face covering in specific settings, and individuals who are exempt from wearing a face covering at all times. And I just wanted to point that out, that the guidance is there, but the specific question is in communal office work, such as cubicles, when employees are sitting down, are they allowed to remove their masks? And if the way that this guidance is written, if people are in a shared environment, they should be keeping their masks on.
And there was a follow-up question to the outbreak definition, or the threshold that we want employers to use for reporting to public health, and about the 3 cases in a workplace. And the question was over what period of time, and that is a 14-day period, just like another listener posted after that. It is 14 days.
I wanted to remind our listeners and participants that we actually have one of our senior social workers and our coordinator over the social workers who are providing COVID-19 resources. So we have Juan and Lynn on, and I wanted to see if there's any questions about resources for those who've been impacted by COVID-19, or if Juan or Lynn would like to say anything.
Hi, it's Lynn Loritz, and I just want to make a comment that there is a great need out there, that a lot of families are struggling when they have to isolate or quarantine, meeting their resource needs, missing work, and food resources are becoming a real identified need. So I wanted to put it out there, knowing that many of you as employers are also providing resources to your employees, and to keep in mind when people have to be at home, especially if their whole family is isolated in quarantine, they may be struggling to get their basic needs met at home.
I just wanted to make a note too that during this call, based on the makeup of our panel, we're not reviewing any enforcement questions. However, we are taking note of them in the chat. So thank you for providing those concerns.
Hi, this is Juan Arellano, a social worker, and I just want to thank all the employees that are providing support for their employees. So thank you for doing that.
There are some specific questions related to there's a specific question related to exposure that maybe Amy would like to take. I'll just read it. How long down a potential exposure chain is it recommended to quarantine if there are no symptoms other than with a confirmed COVID case? And Amy,
sorry, I was muted. The quarantine recommendations for from CDC and CDPH are specifically for a person exposed to someone with COVID. So somebody who is somebody who has had a positive test result, or it could also be someone who has some of the COVID symptoms and has had direct prolonged exposure to a known COVID case. We're not really counting probable cases yet in our data, but there are some provisions to consider somebody who has symptoms and has had direct contact with a COVID case to be probably infected. But once you get to contacts of contacts and so forth, there are no specific recommendations for quarantine. So it's really primarily the person who's had a direct exposure. And then I think there was another question about symptoms, how long people need to stay out of work if they've had symptoms that could be a cold, flu, or COVID. And, you know, it's hard to know in these times whether somebody just has allergies or a cold or COVID, but we're recommending that people err on the side of being safe, and that employers ask employees not to come to work with symptoms and to consult their medical provider. Hopefully the provider can give them a COVID test, or maybe do some other testing, such as testing for influenza. The symptoms of COVID are fever, cough, shortness of breath, fatigue, muscle or body aches, headache. One classic sign is new onset of loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. So as you can see, there's a wide range of symptoms, and a lot of them overlap with flu. It's also possible for people to be infected with both COVID and flu. We've already seen a couple cases like that in our county this year. And so really the safe way to go if you have somebody who's sick is to have them isolate for 10 days as if they had COVID. You know, if they can't see a medical provider or they choose not to be tested.
And there's one question on, is the CDU, or Communicable Disease Unit, conducting contact tracing, or is that the employer's responsibility? So at this time, what we're asking from employers is to do basically, it's like contact tracing light. It's a collection of the close contacts to the exposed employee in the workplace. And but we're not asking for much to do full-on contact tracing. But what that means is that you, because you know your business, you know your industry and your staff better than we do, you'd be able to provide the immediate guidance on the sick leave options. You'd be able to give them guidance on just the awareness that they've been exposed, so that they can be informed by taking precautions to isolate and quarantine. And then by sharing that list with us when there are 3 or more positives in the workplace, hopefully by that time, because you've taken that step of conducting the line, creating the line list and educating your employees of the exposure, you've already helped stop any further spread in the workplace.
Jennifer, it looks like we're at the 3 o'clock hour, but there's one last question. Would you like to take that, or do you want me to read it to you?
Sure, I'll go ahead and read it. For an employee to come back to work, can we ask for their medical doctor to give us a notice that the employee is cleared to return to work? You can, but there is we're not recommending that people receive guidance from their medical provider. And Amy Mays, I see that you clicked unmute. Would you like to take this one?
I was just going to tack on at the end of your response, Jen, but there's pretty clear guidelines in place from CDC and CDPH about how long someone needs to stay out of work. It's 10 days from either the onset of symptoms or the positive test result, and they should be fever-free for a whole 24 hours at the end of that 10 days, and their symptoms should be resolving. That's general guidance, and following that should maintain safety in most cases in the workplace. But I also wanted to mention that there's no recommendation at all to do repeat testing in order to have people come back at the end of an illness. We've seen a lot of that with employers feeling like they would like to see a negative test result after the person having COVID before they come back to work. But the problem with that is that people tend to test positive for weeks and even sometimes up to 3 months or so after they've been infected. And so it's just not practical. And it's also a waste of testing capacity to ask people to get a COVID test before they come back to work.
Okay, it looks like we're at the 3 o'clock hour, and doesn't look like we have any more questions. So we'll close out the meeting. But before I do, I want to thank everybody for your participation and all the speakers as well. Lastly, I'd like to just give you the email address again if you are listening in by phone and don't have access to the chat. That email address again is hsaphadmin@santacruzcounty.us. And again, the answers to your questions will be posted on the santacruzhealth.org/coronavirus website. And again, thank you all for joining us and appreciate your time. Keep safe and have a great weekend.